So I'm lead health and wellbeing coach at ELPCN. I'm new to this lead role, just a couple of months before, but prior to that, I was doing health and coaching with the same PCN, ELPCN. So I started my journey of health and wellbeing coaching in the middle of a pandemic between December 2020, I think, and it was not, as you might know, it was not a good time to start any new role, and that too particularly a role which is new to NHS, and our PCN was new as well. So it was really challenging, as you can imagine, the challenges of vaccination clinics going on, pandemic going on, and lots of other challenges, not going to surgeries, not visiting any surgeries, cannot find out the culture of surgeries. ELPCN has 6 surgeries, so I work across 6 surgeries, and we are based in east of Cambridgeshire, and we have a population of 77,600 approximately patients. So we started with 2 coaches and a health and wellbeing coach lead. My background is in nutrition. I'm a registered nutritionist, and I have experience of health coaching, health promotions, not health coaching, but health promotions, and bits of wide experience across things. So that was my background. So why health and wellbeing coaching? So why I choose that, or why to do that? So I've always been an advocate of lifestyle changes, that uh, going through that, thinking body as a one whole system, and if there is problem in one part, so it affects the other part. So it's a whole holistic approach. So using holistic approaches, so which I believe, for example, if a patient comes to us for weight loss, so it's not just saying, okay, you can just eat rightly and do more exercise and you can be fine. So that's not done like that. So it is always like looking into what positive are they, at the positive mindset, what they're thinking about their body image, working through their mental health, and working through their eating habits, then their physical activities at work, at home, then stress levels they have, their sleeping pattern, a lot of things going on. And those holistic approaches then can bring more sustainable behavior change in them, and that more sustainable behavior change can then bring improvement in their quality of life. So that's the whole journey. And it is so rewarding to see that transformation in your patients from unhealthy lifestyle to healthy lifestyle, and then getting their feedback. So that is a rewarding thing for us, and that's why I think we are here in this profession. And it's a very versatile role, so no 2 days are similar. So we have lots of different patients, lots of different approaches. For some patients, they are really motivated, so we just have to put them in the right direction, setting goals, working with them. And for some other patients, over 6 sessions, we are just talking about, okay, what to do next. You have to just eat breakfast every day, or those kind of behavior changes. So it's not, I'm sure you know, it's not very straightforward thing to do, but it takes a lot of journey, and that's why we are here and we like our job. Ooh, sorry. So yeah, so how do we do what we do? So we all know that this is a part of personalized care roles, which we work with people, what matters to them. So it's more personalized care, person-centered, patient-centered role. So we provide them a safe space to share their issues with us. So we give them that confidentiality, flexibility, and that space, so that they are confident to share their issues with us, and then explore solutions within them. So their solution, it's not our solution. So we try to explore solutions, and we use motivational interviewing techniques. We all know about it. I'm not exploring it. So open questions and summarizing, etc. So, and we use health coaching tools and models that we learn from Peak Health and from our own sources as well. So that helps us to make that shared decision making with that patient. So because we are working on their goals, we are working on their journey. So it's their journey, but we are just facilitating their decisions, and we are trying to dig what solutions they can bring to the table, and then we make a plan of action, and that is a shared decision making. And that changed their activation level as well. So if they are not thinking about change, they start thinking about change. If they are thinking about change, they make changes. And if they are already making changes, they are excelling in it. So their activation level is changes by using that model. And that provides empowerment, that improves their skills, their confidence, and their knowledge, which we have seen is working from Amy's presentations, that she has shown us the data. And that helps in the self-management of patient and self-efficacy. That's like they're thinking about they can make changes. So that is a very empowerment that we can provide them, and we are proud of that. So what helped to develop health and wellbeing coaching system? So of course, training. So training helps also all of us. So PCI accredited training from Peak Health that I took started with 4-day level 4 training. I think all of you have done this. That's why we're here, and which was really important. And I really like the action learning groups from the starting itself. We have that ability to come together, all the professionals, and practice within that area, and we are allowed to do mistakes and correct each other, and learning from each other. So that was a really good approach to learn from each other. And particularly time to think council, I really like to bring in complex cases and then discuss about those complex cases. I remember I brought one case and got lots of good ideas out of that, which was really helpful in building more confidence in speaking with patients when we are doing. And the invaluable connections we made in those groups, and we know that we are here. And that makes us accountability, I'm saying, because it was really hard to do level 2 and 3. So from that push from ALS groups and regularly meeting, so that makes you do level 2, because it is hard to record yourself and then do that all the reflection that we have done. But it is a really good experience, I would say, because otherwise I would never have done that, recording myself and listening back to me. But that gives you like how your tone is, how you're doing, what you can improve on. So it's a really good way of learning. And that makes your professional and personal growth as well, so gives you that. And the clinical supervision we are taking, so at our surgery we are taking, every 2 months we are taking a clinical supervision from clinicians, so our clinical coordinator GP. So it's really good to have that, because we are not from non-clinical background. So to know some of the things, some safeguarding issues and other things, it's really important to take that supervision. And no doubt peer supervisions. We have monthly peer supervisions of all our health coaches, bringing in, celebrating our successes, and then looking into what we could do better with that patient and other complex cases. And health coaching supervisions as well. So I took some from Peak Health, and also they are also available, I think, on our NHS website. So it's really important to take those regular supervisions for CPD. So what else helped us? So it's no doubt to say support from our PCN managers and clinical directors, and we have a very experienced health and coach lead prior to me. So that was really helpful to have them to design our health and wellbeing coaching system in our PCN. And we do promote ourselves within our PCN. So we are working on different surgeries. So we have our flyers to promote ourselves to different surgeries, what we do, how to contact us. And we have managed to have a good referral. So our referrals are really building on from, I would say, it was 20 a month to now more than 200 a month. And that means, like, unfortunately, we can't cope up with it, and we have to have a waiting list. So we have a 7-week waiting list at each surgery which is not a good thing, but in a good thing in a way, so that we are getting good referrals. So we recruited recently 2 more health and wellbeing coaches which is good that our team is growing. We also run group programs. So being a nutritionist, I run a nutrition with type 2 diabetes program, and it's really helpful, and we got very good feedback from it. And we also do a menopause well-being program along with our women's specialist nurse, which is going well as well. Regular catch-ups with and support from other health and well-being coaches. So it's really important to get connected with each other. So we have every Monday morning we have meetings of half an hour just to catch up on what went well last week and what's going to do next week. So those kind of things. And using validated tools. We are using MICA to validate what we are doing. So it is a really straightforward and nice tool to show the evidence of the effectiveness of our service, what we are doing. So it's a point-based pre and post form, so which is really good. And we use anonymous feedback forms from our patients. I know we have to do for peak health level 2 as well, but we were doing it previously. So it's good to see that how we are doing, and feedback from our colleagues as well, so you know when you're doing something good. So I still remember one feedback from one of my colleagues saying that, Vandana, can you please use your magic wand to help this patient to improve her HbA1c? And that was good to see that, okay, we are working something good. That's why we are getting that kind of feedback. And we have a very closely knit team of health and wellbeing coaches. We have 7 coaches and a lead now. And my colleagues are here. They can wave. Emma, Mazio, and Jitenda. So building connections across team and organizations. So in my lead role, I'm building connection with other organizations as well. So Oli was mentioning integrated neighborhood team. So we are doing some projects with them, which is good. So at the end, I would say health and well-being coaches is well accepted by our patients and our PCN, which is evident by the number of referrals we are getting and the feedback we are getting from our patients and also from our colleagues. Our patients seems they value they value the additional time given to them and the additional attention given to them. Obviously, they were very happy. They tell us that we do know that these services exist, and we give them 45 to 1 hour, so they can complain about other services to us as well, so which is good. So it can alleviate the workload from other services, so other important services like GP and nurses, so they have more urgent patients so they can deal with. So this health and well-being coaching or other personalized care roles, they have potential to empower patients to manage their own health, and that is really important. And they can pass on this knowledge to their future generations, their children as well, to take care of their own health. So I'm sure that it can change our health system within next 5 or 10 years. So thank you for listening to me, and if you have any questions, let me know.